Learning to search PubMed. Search engines are information retrieval systems that search the internet and electronic databases for websites, files, or documents based on keywords or phrases. Examples include Google Scholar, PubMed, National Center for Biotechnology Information, and PT Now through the American Physical Therapy Association. Databases are organized systems that allow search access for specific content or information. Bibliographic databases contain lists of citations of published and unpublished references. Examples include Cumulative Index to Nursing and Allied Health Literature, Cochrane, Pedro, and Ovid. This is an example of a clinical question. The components include a specific patient profile, physical complaint, physical therapy intervention, and functional activity. A clickable version of the link below is available to you, and it appears below the video posting in the module. Pause this video now and return to the module to click on the link, and follow the instructions provided to view a 3-minute tutorial titled PubMed, Exploding the Medical Subject Heading. Welcome back. Here is a list of keywords taken from the clinical question, alongside our MESH terms. MESH stands for Medical Subject Headings, developed by the National Library of Medicine to develop consistent terminology. MESH consists of sets of terms in a hierarchical structure or tree that permits searching at various levels of specificity. The tree starts with broad categories such as anatomy, disease, or analytical, diagnostic, and therapeutic techniques and equipment. The next step is to reorder your list of terms by order of their importance. Based on your search result, you may want to repeat your search. If you don't obtain many listings in your search, you may need to explode your search. The search will retrieve results using the selected term and all of the more specific terms in the tree. If the results of your initial search are overwhelming, you may need to focus your search. You do this by restricting the search. The results will be limited to documents where the subject heading is the major point of the article. When performing a search, it is important to fine-tune the choice of the keywords or reference terms to narrow the search. Most databases and search engines use a system called Boolean logic. Boolean logic utilizes 3 primary operators: and, not, and or. Additionally, most databases will recognize truncation and wildcard symbols that can be used to allow a broad interpretation of a search term, finding plurals, spelling variations, and alternate forms of words. Each database specifies the symbol to be used, such as a question mark, asterisk, or $sign. For example, entering the term sensitive with a $sign added to the end in PubMed will retrieve articles that include sensitive or sensitivity. The term woman, spelled with a $sign replacing the A, will find woman and women. Refer to box 31.1 in your text for more examples. Here is an example of a search combining the words exercise or exercise therapy in parentheses and chronic neck pain. Figure 31.1 in your text has additional samples. You can set limits to your search, which is another way to narrow your search. You can limit by publication type, language, or date, to name a few. Some databases offer to send regular automatic email alert updates based on a search profile that you create. Listed here are some of the more common search engines and databases. We will explore some of these in class together. Search the literature for this clinical question. First, identify the key words. Then match with MESH. Next, reorder your terms and conduct your search. Please bring your laptops or iPads to class. We will be using them to conduct more searches. We will be looking at different databases that can help you with your tutorial preparation. You should have time in class to perform some independent searches, so feel free to bring a topic or research question to class to explore.